to the kidney 2 point. K2 is the most amazing. I love this point. So in fact for the day-to-day clinical practice, but I remembered now one word to be known as a Dr. Watanabe, Hiroshi Watanabe, who is a Japan doctor who invented known as a PNST, prickling neurostimulation technique. I have gone through his book and he has written the beautiful information about the K2 activation to the kidney 2 point, that you are activating to the throat. You are activating to all the pharynx and then larynx and also throat. No, anything the throat related disorders can be treatable by activating the kidney 2 point. He also written one important point. Once we use the hot water immersion of the foot, called as a foot bath therapy, we place the water till the kidney to ankle region, the medial malleolus region. For 20 minutes you keep it the foot bath with plain warm water or with the Epsom salt known as a magnesium sulfate. Around 20 minutes, having the great effect to treat for the throat disorders. Now we try to understand. Throat means numerous disorders, majorly to be known as a thyroid problems. Also it is as a lungs related disorders, tonsillitis, pharynx and larynx related infections, and these are the throat issues. But anything connected to this, throat irritation, throat pain or dry cough, all can be treatable by using the foot bath therapy itself. सिर्फ क्या करना है, गर्म पानी में पैर रखना है, सिर्फ गरम पानी. But how much you can bear the heat, that much. 20 minutes. In 5 minutes the heat will come down. In 10 minutes heat will come down. Keep it as a hot water with you and then take that water and then put it again, it is the hot water next to you. Take around 2 tumbler, 3 tumbler and then put it 2 to 3 tumbler so that you can maintain the heat. So therefore, once the K2 is activating, that having the strong effect on the throat region. Hopefully you understand. At the same time, when the patient having the hypertension patient, BP patients, so this blood pressure, due to that there is get the distension and swelling and then lower extremities called as a pedal edema. So that edema to be controlled and passing the elimination of the unwanted substances of the fluid which is accumulated on the intracellular level, that will move off by using the K2 point. So therefore kidney 2 points are very good point for the blood pressure patient with having the distension and swelling on the lower extremities. Below the knees they have the swelling, that particular time it is recommended to use the kidney 2 point. At the same time, when we wanted to treat for the swelling, K2 and then folio rangu, both the points, K7, both the points are really wonderful point to treat for the any kind of the swelling on the lower extremities. It is recommended. One is the swelling on the lower extremities, keep it in the mind. If the BP patient is there, for him and then 2 points is recommended. One is the K2, the second one is a K7, and the third supplementary point to be known as a in Ling Chuan, that is a spleen 9. There are the 3 most powerful points to treat for the swelling. So stage 2, the CKD problem, when the eGFR glomerular filtration rate has gone down to the 60 to 89, the above 90 is recommended. the EGFR rate to be known as a above 90 to be recommended, but these days I am seeing the EGFR is drastically coming down with the patients less than 90. So less than 90, that is indicating that your kidneys are filtering the blood is little poorer than the normal. So even that particular time also recommended, the K2 point is recommended to regulate the cardiac system, because the K2 is equivalent to the H3 and K2 is equivalent to the pericardium 3. So K2 is the water point, wood point and then fire point. This is the K2 is not the water point, K2 is the fire point, therefore that is communicating to the heart H3 and then K2, both the functions are same functions, K2 and then H3 and K2 and then pericardium 3. These are the points are same functions. Hopefully P3 last week he completed, and then H3 also we completed. H3 is the grandmother point, K2 is the grandson point. So therefore this is depleting the energy, that's communicating to the heart system. Now do you know the hypertension patient, edema patient, how we communicated? K2 is equal to H3, that means it regulating the heart. When the regulating the heart, that BP also gets control. When there is a metabolism, water metabolism is not doing, then kidney belongs to water element, the water purification or water retention to be cleared. Hopefully you understand these sequences and concept and link between each other. Based on that perspective, you keep it in your mind. That's the reason if somebody says, because no one told this is the communication, that's the reason this is good. But your idea you need to strengthen to understand that this K2, why this is good for the BP reducing the edema patients, but due to this reason there is the communication in between each other, it regulating to both the system. K2 is good point to treat for the hypertension and also for the pedal edema as well, right? At the same time, all the throat related disorders, the tonsillitis and the pain related conditions, when the throat only related problem is there is no hypertension, even there is no swelling, also recommended to apply this needle, especially the K2 is recommended. When the throat pain is there or throat irritation is there, another 2 points as a supplementary and combination points you can activate. The point to be known as a Shaosheng and then Shaohai, that is the LU11 and then K6 and then K2. These are the 3 combination protocol, really will be helpful to treat for the throat related disorders.